Good afternoon, everyone, and welcome to Reach Out and Read of Greater New York's Keynote and Award Ceremony. My name is Emily Marchese, and I am the Executive Director of Reach Out and Read of Greater New York. In our 20-year history, we have grown to serving over 250,000 children every year, providing books and early literacy guidance and linkages to families across the city. But we've never been more proud, more humbled, or more inspired than this past year, bearing witness to the profound sacrifices and dedication of our pediatric healthcare heroes. Through uncertainty, ever-changing information, personal and professional stress, you have seen it all and never wavered in your dedication to the community. It is in recognition of your heroism that we hold today's conference. Together, we rise to the moment, supporting and celebrating the hard work that is behind us and the new chapters that are beginning. On behalf of myself, the board, and the team of Reach Out and Read of Greater New York, it is our privilege to support you, the pediatricians and healthcare workers who show up every day for our families, for our caregivers, for our children. I also want to thank our supporters for their steadfast and profoundly generous commitment to early childhood literacy, including our sponsors for today's event, Scholastic Books and Dorothy Weintraub, our wonderful board president, Jack Pace, and Gary Tannenbaum and Helen Mills. To give a brief rundown of our time together, we will begin with our keynote speech by Dr. David Willis titled Rising to the Moment, Inclusion and Early Relational Health. Then we will be moving into the awards portion of the event, where we will recognize 9 outstanding medical providers and children's book author. We will wrap up with some great discussions during the town hall. It is now my pleasure to introduce our esteemed keynote speaker, Dr. David Willis. Dr. Willis is a senior fellow at the Center for the Study of Social Policy, where his focus is on the intersection of child health and broader community-based early childhood systems. Before joining the Center for the Study of Social Policy, Dr. Willis had previously been the executive director of the Perigee Fund, where his work was focused on the promotion of early relational health, the strengthening of the social and emotional development, and advancing the field of infant mental health. A developmental-behavioral pediatrician, Dr. Willis was a clinician in Oregon for more than 30 years, with a practice focused on early childhood development and family therapy. In Dr. Willis's words, advancing early relational health is not about a new field or a new program, but rather about the adoption of a new mindset and skills in pediatrics that focus on the centrality of the foundational relationships of early relational health to promote health, development, and social well-being for our children. He will bring an overview of these efforts focused in part on leveraging Reach Out and Read, and then his view of what's emergent and groundbreaking in child healthcare transformation and early childhood system building. Dr. Willis, welcome.
Well, thank you, Emily, so much. Greetings to all from the West Coast. I'm going to share my slide set now, and let's assume that we're all good. So you can see this, I trust. I'm delighted to be with you all today in this celebration, certainly of the healthcare heroes of all of you of this past year and over your careers that have been strongly supporting child development, early literacy, family relationships, and the like. And it's such a moment in time now as we really look at building back better after all we've been through, all you've been through this COVID time. And increasingly, all of us recognize the criticalness of relationships, the criticalness of being connected, the criticalness of really focusing on the relational experiences that will be required to build back better moving forward. And I'm delighted today to just share with you a few thoughts. I have no disclosures. And of course, I want to acknowledge that I'm in Washington State and where we have 29 federally recognized tribes, 7 non-federally recognized tribes. And I'm in the lower part of the state in Clark County and live on the land of the Cowlitz tribes. And today I want to share with you in a very brief time in your celebration, but bring to you how we always in pediatrics are expanding our knowledge and the criticalness of expanding our knowledge about relationships and how they are the foundation for health, development, and social well-being, I want you to reflect on your own mindsets of the way you think about your partnership with families and those foundational relationships and your contribution and support of those experiences for families. And then I hope that you'll have a take home of some thought or action that you can make to build out within your Reach Out and Read work in your daily practices with families, promoting strong relationships. It's astounding, isn't it, what the science tells us about how early a baby's future gets started. My own journey in my career has made that clear, that prenatal experiences, early postnatal experiences, those moments that start, and the relationship experiences is what builds the next generation's health and mind, brain, physical development, and all of that starts incredibly early in some really striking ways. And we've all been immersed in that sense of the core story of child development, and over the decade of the brain and over the last 20 years and more, even continuing presently, that focus on child development, talking a lot about building brain architecture, talking about the criticalness of the science about genes and environments interacting together, talking about the inextricably connected efforts of mind development around cognitive, emotional, and social capacities. We talk a lot about toxic stress and adverse experiences, brain plasticity, and the like. But we also talk about all child development occurs in the environment of relationships. But I would suggest to you, we've not built that out strongly enough in terms of our science, our actions, our activities, our specifics of what we're going to do. Even this last 6 months, there's been increasing papers talking about the biomarkers of toxic stress and how one can identify those, and the whole movement about the ACE movement and the like. But the criticalness of buffering and countering relationships is the work that has yet to be done, and the excitement of the field that we're really trying to move forward. Relationships matter. Early relationships shape the health and well-being of both the child and the caregiver. It's actually bidirectional. Parents, new families experience in their relationships with babies changes of their brains, and good work that would show that there's even countering adversity by strong, positive, supportive relationships for parents themselves. So not just the utilitarian view of building the next generation's health and development, but strong relational patterns with children, young children especially, are meaningful to the health and well-being of parents themselves. So we're talking about early relational health as it describes those positive, nurturing relationships that advance physical, developmental, and social well-being and resiliency. All of that work is in this frame that we're now talking about early relational health, not a new term, a new term, but not a new field, nor actually a new series of discoveries. It builds on decades of research from the fields of child development, infant mental health, neurodevelopment, but intentionally calling out early relational health focuses us on the centrality of relationships that stand next to promoting physical health, promoting early literacy, promoting social emotional well-being, promoting the capacities of future well-being, all come from those early relational experiences, and critically. Let's talk just for a moment, let's just look at what we're talking about. All of us in pediatrics know the beauty of these interactive experiences.
Uh-oh.
Relational health lies between the dyadic experience in the relationship itself, and you're witnessing that as we speak between them, something very powerful is happening that we're really witness to as pediatricians. And similarly, go to the next slide. Similarly, many of you remember this video that went viral of a toddler and his father, and the joy of millions of people as they watched this interactive dance The relational health of this dyad.
Yes. Okay. Did you understand it though? No. Okay. All right. Huh? Oh, no, not this one. This is the grand finale of this.
And I would ask yourself, what are you witnessing that is between them that one would say is strongly a positive relational health experience? What are you witnessing? What are the elements? How do we turn our objective eye into the characteristics that are observable that have all of us know that this is a strong, positive, supportive, and relational process and dyad? What are the specific elements that would have you describe that in our good scientific ways?
Yeah, that's the last one.
So you see serve and return.
That's what I was wondering. I don't know what they're going to do next season because they did some stuff this time.
You see verbalization, gesturing, experience, a shared mind experience. Each is shaping the other. It's balanced.
Right. Don't bring that again. You know what I'm saying? Don't do the same stuff. You know what I'm
They
saying?
understand each other.
Yeah.
That shared moment is really powerful and striking.
Yeah. Like go
So relational health is observable. And in fact, there's a whole sequence of the development of relational health patterns that are observable that we can see every day. And it develops sequentially. And the skills emerge in those first 2 years and are critical to what becomes later social emotional development, what becomes early literacy capacity, what becomes future emotional, if not positive mental health. It begins very early. We observe it in primary care pediatrics. We see that mutual attention and engagement. We see those responsiveness in the relationship. We see the positive affect or not. We see the beginning of imitation and the initiation processes of interaction. We witness the process of being together in play spaces, be that reading, playing, talking, singing, and the like, that are a part of all we know in Reach Out and Read of criticalness of strong relationship patterns. Under all of this is a strong scientific recognition of what happens in the physiology of brain-mind development, the bio-behavioral synchrony that is in every system of the physiology that builds in that interactive space so that we can witness the behavioral patterns that are in synchrony, that serve and return, that turn-taking, that shared experience, that dance of beautiful behavioral patterns. We can also see it ever more complexly if we look at slowed down video sequences of the dyadic interactions, and one can see the complexity of nonverbal dancing, of the physiology and movement and of communication. We can see it if we measure heart rate variabilities and the autonomic nervous system and systems are become in tune, become entrained between the dyadic pattern of parent and child. We know that there are endocrinological patterns that get entrained in synchrony, and we know even that brain systems become coordinated in their oscillation of the rhythms of EEG patterns when there is strong relational health, strong attachment in those eye contact interactive patterns. The physiology of building the next generation's physiology gets downloaded in that experience into the development of the next generation. That is in the context of early relational health. So we're talking about this important shift of our mindset that looks not just at the child, but looks at the relationships themselves that are building the well-being. It's science-based, it's strength-based, it's family-centric, and building on Bob Sege's work about hope, it's about health outcomes of positive experiences. All of this arises in listening and partnering deeply with the strengths and resiliency of all families in support of their capacities. It is grounded in human dignity. It's clearly anti-racist in recognizing that it's not that race is not the driver of well-being, it's racism that is the disruptor of well-being, and relational supports and must be mindful of those efforts. This is not about a new program. It's about actually all-in approaches that focus on the supportive relational patterns from the start of all things. And it also gives rise to how we have to think about the movement of policy changes. All of this is not about adversity, but about building a paradigm shift that focuses on the health outcomes of those positive relational experiences, promoting relational health in all ways. I'm fortunate to be at CSS Center at the Study of Social Policy. We built a national early relational health coordinating hub. One of our strongest efforts in terms of child health practice transformation and building in terms of building measurement is in our partnership with Reach Out and Read. And I'm really delighted about that, which I'll just touch on in a moment. But we're also working in place-based communities, working with those communities that are well organized around early childhood system building and have strong home visiting networks, increasingly even those communities and states that are building a universal access to home visiting. And then all of this, of course, requires partnering deeply with families, learning with families, and building an equity agenda. And behind all of this work around early relational health is mindful of policies that can support dollars that support practice change and improvements of the lives of families. But the Reach Out and Read story is well known to all of you. There was those beautiful videos that were shared at the start of this celebration. This little video again shows the power of what we experience in primary care practices as we book share and as we have the opportunity and the privilege of being with families in those relational shared moments. And that work is really forms the core effort of our efforts about advancing early relational health through Reach Out and Read. You may be aware of the next chapter work that's been increasingly described for the national office about Reach Out and Read being a platform for advancing foundational relationships in early relational health. The work is increasingly recognizing that we have the privilege as pediatricians to be with families soon after birth, and we can set the trend of relationships matter, not the least of which is for education readiness, but for health and development, and that relationships matter to families too. We've begun some work with Martha Welsh at the Nurturing Science program at Columbia, where we're actually beginning to define what are the vital signs of early relational health. My colleague at the AAP president, Colleen Kraft, about 8 years ago was quoted as saying, relationships are the new vital sign in pediatrics. And we're looking at how we can build out what those key elements are of those vital signs as we are with families in Reach Out and Read visits as to observing the relational patterns that really matter. That those 4 key elements of autonomic emotional connection, those fundamental connecting points, include how one observes the attraction that is dyadically experienced between a baby and a parent, how we can observe the vocal communication processes between them, how there's a shared facial expressiveness, and how there's a sensitivity and a reciprocity. We're learning that this is built by eye contact and about the criticalness of a shared eye contact experience that builds the foundations for autonomic regulatory systems, which are foundational for future social emotional development. You'll be hearing more about this as the work nationally moves forward, from the work from in Jersey, as well as other networks that are beginning to explore how one can train Reach Out and Read pediatricians in recognizing those vital signs of early relational health and how those are predictive of later social emotional development. That work is moving forward, which I think is incredibly thrilling. In addition, when one notices vulnerabilities in the dyadic process, just like we do with developmental screening, we identify those where the where the screen passes such that there's no identified vulnerabilities, or where we identify by a screening vulnerabilities that might require promotion supports or even perhaps referrals. The same thing will be developing around early relational health observation, That is, there are many situations where we notice strengths in the relationship and we celebrate that. And there may be situations with young families where we can provide some guidance for attending to supporting stronger relational patterns as observed. But there will be situations, of course, where there are weaknesses. And of course, that opens up dialogue. How do we talk together with families about the criticalness of relationships in support of them? And what do we do when there's vulnerabilities? There's some beginning work about using video feedback with families in terms of either the co-located mental health provider, or be that team-based care models like Healthy Steps or Project Dulce, or the application of VIP, which is a video interaction project where video feedback as a part of promotion strategies and strengthening strategies really are relationally centric efforts to create a parent's awareness of themselves in the interactive space with families. These kind of efforts are likewise promoting a relational framing. There's some work also going on in some communities in DC where the focus of every visit is upon having relational conversations with families, starting prenatally, then postnatal visits, and on within that effort about being mindful of the drivers and challenges of history, adversity, of social determinants, of histories of challenges, but having authentic conversations about how do we protect and strengthen the relationship in face of challenges and these efforts. We're also working in all of trying to bring strength to all the supports around communities such that we are not alone as the health system, but rather deeply embedded in a place-based community where all support services around families are focused upon supporting the earliest relationship patterns and building the well-being. One of the best examples of that I witness presently is in Bridgeport, Connecticut, where the Bridgeport Prospers effort has an all-in strategy where the health system's doing their work, participating and urging the relational health work as well as identifying family need, where there are a universal home visiting Family Connects model being built such that all families are touched in terms of promoting and identifying the needs for families in their community, where local informal and formal organizations are moving upstream in supporting families around the birth of their children, where there are neighborhoods, churches, and community citizens who recognize that supporting new families in their neighborhoods next door or down the street and is a part of an all-in strategy of building out a focused effort upstream with a relational health framing in an all-in strategy to address the well-being by kindergarten readiness for sure, but also even Head Start readiness by age 3, focusing on improving the well-being of the life course trajectory. That work is moving forward as we speak. This is an unprecedented time in this moment with the Build Back Better strategies of the new administration, with the American Rescue Plan Act, with the stimulus dollars that have come to families, with the child tax credit and ETIC that we hope will continue as becoming a new national strategy, not the least of which has been $6 billion that have been appropriated to now expanding a public health workforce and building out community health workers and local social support networks that we now can begin to talk about building out a relational health workforce. That the dollars are just beginning to flow out of CDC and out of HRSA to communities where they can start organizing a new workforce of relational supports for families. The policy space is working hard to see that the dollars of building the community health worker focuses on the supports of the youngest of families, be that doulas or family navigators or promotores or family coaches or expanding home visitors. And there's a lot of discussion now going on about how do we link that supports to our medical home efforts in support of what we're committed to within Reach Out and Read. A couple more thoughts I want to share with you is the criticalness of anything we do around early relational health has to be in partnership with families. When I first went to CSSP, one of the first things I heard from my colleagues there was be careful, because as we start talking about advancing early relational health, let's not create another way in which parents can fail. And that spurred us to begin building partnership with families. And our first work was in Oregon, where we did some focus group efforts with groups of parents to help guide us about what does the medical provider's role, what can it be in the support of those foundational relationships. And from our focus groups of African-American families, focus groups with Hispanic and with even rural families, there was actually some notable skepticism at first that we heard. The first message from parents was, I got to have a trusting relationship with my physician. We provided a webinar of those findings, and in that webinar, my colleague Brenda Blasingame from the Pritzker Children's Initiative made the following statements about the experience that families can have with us and this amazing opportunity of the health of us as physicians partnering. Can I come to you? Your first impression.
It's so interesting that part of when you were just speaking, what I was hearing was coming to it around quality, but separating that quality from the quality of quality improvement. And so when I think about that, the two things that were going through my head were meaningfulness and mindfulness. So meaningful engagement with the family, with the parent and with the child when they are in that appointment. And that engagement doesn't have to be for 15 minutes. Meaningful engagement can happen in small, minute pieces. And it can send a specific message to the parent and to the child about your level of caring. I think that's that empathy coming through and that compassion coming through when you're doing your care, but also the mindfulness piece. I do think that when we think about things like implicit bias, and David, I hear you every time you speak talk about how pediatricians want to show up and how they want to do their work. And for me, understanding the medical system and how the healthcare system works, that does mean taking on the personal accountability for being anti-racist and working on yourself individually as a service provider so that when you're in those moments, you are mindful and you are coming from a very different place. And especially because of the lack of time and how rushed doctors are and all of those things. I think the meaningfulness and the mindfulness together with that quality can make all the difference in that appointment that is always too short and never long enough.
And that's what matters to us so much in Reach Out and Read, those in the moment times with families, those simple moments of recognizing the strengths of rich relationships, and those simple moments of providing a book sharing opportunity that strengthens the relationship itself for the developmental process. Those short but multiple times that we have to meet with families over time is such a unique opportunity to advance our early relational health frame. So finishing up, a couple thoughts about that we all carry forth that are important to share with our families, and that is every human relationship helps us weather the adversity and protect our youngest from harm. That's what has been a part of the so critical for all of us to know during and to share during this moment of COVID, that relationships protect and being mindful of that. And those simple, ordinary interactions matter. Those day-by-day moments of reading, of book sharing, of singing, of having meals together, of changing diapers, of saying goodnight, those simple interactive moments of relationships are priceless, precious, but also important to the future well-being of the family as well as for the child. And nobody has to be perfect. There's so much redundancy built into human development that there are many opportunities to build on it, to improve, to recover, and to build forward. A couple last thoughts, and then I'll finish. I actually believe that children develop parents as much as parents develop children. And any of us that have had kids know that that journey is a pact. I mean, we're on a journey with them, and they pull from us what they need. And we have to be responsive and reactive, and we contribute a bit. That's, and so I absolutely believe in that mindset, that it's a journey together with their child. The second thing I would add is, I also think that the wisdom that goes generationally also is a part of that journey, the wisdom of many. And no parent is perfect, nor do they need to be. And no one parent is responsible for the healthy future development of their child, because it's far more complex than that. But the journey of the multiple relationships are a part of assuring well-being. So that's why culture, that's why I think networks of people surrounding young families is a part of the resiliency strategy that captures healing, recovery, and optimal growth and development. That's how I think cultures have evolved to create who we all are now. It was not one little dyadic experience. It was the collective wisdom, and that was brought to the next generation, either directly or indirectly. And there's a lot of indirect human development that happens when we provide the opportunities for children to grow and thrive from the people that are around them. So I thank you all for the opportunity of presenting with you today. I'm honored to be a part of your celebration for your healthcare heroes and for so many that have weathered this incredibly important time. I applaud Reach Out and Read Greater New York for its relational health focus. I applaud each one of your efforts day by day and what you do with every family that you reach, and believing that those relational moments of reading and book sharing, and ever more setting the tone that relationships matter from the first encounters you have with families, is the movement that Reach Out and Read is going to champion in this transformational space in pediatrics over time. So thank you for the opportunity of being with you. And Kristen, can I now turn it back to you?
Yes, thank you so much, Dr. Willis. I am feeling very inspired by your presentation. And I want to open it up in the chat box. If anybody has any questions, we have him here for a few more minutes, and he's happy to answer any questions. If not, if you think of them later, that's okay too. Perhaps, Dr. Willis, we can send them to you in an email if we think of things a little bit later.
That's great. And I'll be out around through the rest of the session, so I'm happy to respond to anyone privately or openly. Thanks.
Amazing. Thank you so much. I know I will want to hopefully end up in your breakout room later.